Hello, my name is Sarah Holden. I'm a registered nurse and independent nurse prescriber. I've run my own aesthetic clinic for 14 years and worked as a trainer for 9 years. In this video for Derma Institute, I'm going to demonstrate marking up of the zygoma, the cheekbone, and techniques used for injecting facial aesthetics, such as bolus, linear thread, crosshatch and serial puncture. Also, we will discuss facial assessment, which is key to a successful outcome of any aesthetic treatment. Marking the zygoma. Assess the face from all angles, at rest and animation. A cranial view. Palpate and mark the superior and inferior borders of the zygoma. Draw a line from the upper tragus to the alar groove. Draw a vertical line from the lateral orbital rim to mid-cheek. Where the lines intersect should be the apex of the cheek, in females the point of projection. Mark lateral points along the zygoma for a bolus technique. Techniques. Selecting the appropriate technique and the correct product for the area of augmentation allows natural and confluent movement and harmony with other facial features. All injection techniques should be delivered slowly and carefully. Mark your injection sites as appropriate. Decide on needle or cannula. Both systems can be used, for example in the cheek, to achieve lift and contour. Bolus technique. Using a needle, product is delivered onto the periosteum for lift and projection. This technique is often used in the cheek, the chin, and the gonial angle of the jaw. Prepare the skin and mark the area. Clean the skin again. Use your non-dominant hand on the face. Gently advance the unprimed needle. Identify the periosteum. Aspirate and slowly inject a bolus of 0.1 to 0.2 ml without pushing the needle onto the periosteum. Linear thread technique. Used for the nasolabial fold, body of the lip, jawline, cheek, and submalar. The tissue plane is subdermal and deep dermal. Cannula delivery. Mark the area and entry point. Estimate the end point by gauging the length of the cannula. Clean the skin again. Using the trocar needle, make the entry point. Allow a moment or two before removing the needle. Remove and gently insert the loaded cannula. No need to aspirate. Stretching the skin can help. Rotate the cannula if the tissue is resistant. Slowly inject the product in a retrograde manner. 0.05 to 0.1 ml per pass. Fanning the product can also be achieved with multiple passes in a fan shape. Serial puncture technique. Needle technique for fine lines, perioral, cheek, submalar and neck. The tissue plane is deep dermis. This improves the skin quality and hydration. Perioral. Inject across the line for support and hydration. Small aliquot deposits of 0.01 ml. The product should not be visible in the skin. Crosshatch technique. For areas of volume loss, such as the submalar. Cannula technique. Mark the area for augmentation and clean the skin again. Make the entry point with the trocar needle. Work in a lateral to medial direction. Entry angle is almost parallel with the skin. Work in a grid on facial zones. Make a second entry point to facilitate laying threads in a crosshatch fashion. Advance the cannula as in the linear thread technique. Lay several threads.